urgently and for them to be implemented as we had seen earlier, such as the critical illness. And the UON, through the Center of Epidemiological Modeling and Analysis, is going to host the panel and joint secretariat. So the vetting of the nominee CVs is ongoing, and a review of the MOU is underway. It will be signed by 24th February and gazetted by 28th February. So we want to assure you, governors, we are not sleeping in terms of benefit package. We have advisory team on board, and if there are any concerns and grievances, then they'll be exhaustively addressed by this. So these are wonderful news for us. We have revision of the benefit and tariffs package. There's additional funding through the supplementary budget to facilitate, number one, an increase in funding for ICU. Previously, we were at 4,480. We are happy to report that now ICU will benefit from 28,000 Kenya shillings per day. Equally, that's good news. So again, for oncology services, we are happy. Previously, we were at 150,000, and following concerns from the public, we have been able to increase. Sorry, we're at 400, but we have increased to 550,000, an additional 150 for the oncology cases. So again, that is a good point for us. And equally, in the later slides, you'll see the issue of procurement, bulk procurement, to ensure that the prices of some of these medications are worked on. And after review, the revised benefits will go through the legal process for gazettement. Again, another concern that has come up from Kenyans is the overseas treatment. And the SHE Act provides for overseas purchasing of healthcare services not available locally. However, this requires accreditation, empanelment, and contracting of the providers and facilities overseas. And so we continue undertaking overseas treatment. Work is ongoing. We need the Ministry of Health, KMPDC, to review the patients who are going outside. And after giving the, they can go outside, then they can be seen. But let us remember that currently we are having 500,000 shillings for this, all inclusive. So maybe I can highlight, at times some of these things may not be addressed. It's important that they go through review by KMPDC, they go through review by Ministry of Health before they are released, because we've had challenges of patients going to facilities that have not undergone the right accreditation, or asking for money to be sent into their bank accounts, etc. So this again is a need-by-need basis and needs a review by our team. Again, means testing. Previously, as you know, our previous means testing, people would cheat the system, and this has had great impact in terms of our average. You'll see later on, our average currently is at 560, I believe, and yet we need 880 for this as an average means testing for the system to be sustainable. And so we went back to look at the means testing, and we have a new algorithm which is under development. And it will rely more on data triangulation from other existing databases in government agencies for improvement of the accuracy of means testing. So the database will include KNBS, KRA, Immigration Department, Hustlers Funds, KPLC, among others. So the data has been requested. We are collecting all the data and reviewing it, and we believe that we should be able to roll out the new means testing very soon and plug it into the insurance premium financing, because ultimately for the system, for Taifa Care to be sustainable, we need to have the resources at hand. So we want you to encourage people, even as they register, they need to contribute. That way when we have resources, sustainability is again successful. Okay. So our key asks. First of all is the funds for payment of old NHIF debts. As you know, there are a bit of lamentations from healthcare providers, and so we are working to finish up on that debt. Equally, the civil servant scheme that is included to facilitate access of healthcare services for our civil servants. Again, additional funding for improvement of benefit packages because of the concerns that have been raised by the Kenyan people, and identification and financing of indigent population by counties. IPF implementation, again, to support informal sector is really critical. That way we can have contributions up and running and have a successful implementation. Again, we need your support, dear governors, in the rapid registration initiative for SHA registration as well as a premium payment in the counties. That way we'll have enough resources to make it sustainable. Regarding human resource for health, for the CHPs, we have more than 107,000 CHPs in Kenya, and the national government has provided 100,000 CHP kits, and government has allocated resources for the payment of 100,000 CHPs in the country, 2,500 from national government, 2,500 from county government, totaling to 5,000 per CHP per month. And the payments of CHPs across all counties have been effected up to the month of December 2024. 8,571 staff have been transitioned under the UHC program, and process on the implementation of commitments made to doctors, nurses, and clinical officers is ongoing. Equally, public officers' medical scheme for funds for public officers is ongoing. So these are the commitments for return to work formula for the doctors, and you can see the issues raised, including basic arrears, internship, harmonization of union members' employment by national government, postgraduate arrears, among others. And we are happy to report that 11 of these issues have been addressed. The one remaining is the internship component and conclusion of the CBA. As well as employment of additional doctors to support the implementation of UHC. So I think we need to highlight that during our meeting in November, December, we talked about 206, but for the new cohort, we are talking about 70,000. And so negotiations will start to ensure that, again, this is implemented. So the ERLC in Eldoret rendered judgment on consolidated petitions on 17th October, upholding the legality of SRC circular. However, the court observed that SRC rates were at variance with the 2017 CBA, and it directed that we negotiate with the KMPDU within 90 days. And to forestall the strike, as I said, we met in December 2024, and interns again were posted. The CBA rates were affected, and now there's a current cohort that will be joining of 4,332 in all cadres, and there's need to resolve the salary or stipend rates of the interns once and for all. So as I said, we'll be having meetings, and as you can see, these are the 4,332 graduates broken down in the various cadres, medical interns, dental pharmacists, etc. And below you can see the budget requirements for up to 2025, for June 2025 from financial year 2024-25. So you see that using the SRC rate, we will be able to save a lot of resources and support to the doctors, and we look to, and other healthcare workers. So we look to start our engagement with regards to that. Regarding the pending CBA and negotiation